It is, isn't it? There we go. All right. All right, I call September 3rd's Public Works and Health and Human Services meeting to order. Please rise and say the pledge with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Thank you very much. Is there any additions or changes to the agenda?
No, sir.
Okay. Can I get a motion? All right, all in favor signify with aye. Aye. Opposed? All right. Next, we have the minutes from August 6th. We got a motion and a support. All in favor signify with aye.
Aye.
Opposed? All right, carries. We're moving on to item number 5, limited public comments. If there's anybody that'd like to make a public comment, please come up to the podium. All right, seeing none, we'll move on. Item 6, agency reporting. First, we have the County Health and Healing, or excuse me, the Healing and Recovery Center.
Morning. All right. We'll begin with the financial commentary. Current cash balance as of 7/31 is just over $8 million. The financial position for ECARS continues to improve. Year-to-date net income is totaling just under $1.3 million, which is approximately $130,000 revenues over expenditures per month. Operating results continue to yield positive balances. Year-to-date, just about $1.1 million. Just as a reminder, I carry this as a placeholder. Our cash balance has approximately $1.7 million that the state of Michigan is yet to reconcile from prior periods, basically during the COVID period when they were not completing audits throughout nursing homes. So that'll be reconciled at some point. Occupancy for the facility is very strong, hence the financial performance. Year-to-date average is 125 residents. Last year, we budgeted and ran about 111 patients per day, and the prior year was roughly 109 patients per day. Our hospice hybrid neighborhood census that we brought online that had been offline for approximately 2 years through COVID is performing well, average of 12 residents per day. Year-to-date, ECARS has provided inpatient, outpatient, and long-term care services to 386 community members. Approximately 350 of those 386 are Eaton or were Eaton County residents. That total represents roughly 38,000 patient care days year-to-date. Analysis of outpatient therapy performance, revenues exceeding expenditures. With allocated expenses, the program breaks even. Commentary, I think I shared the last time I was here, we developed an LPN apprenticeship program. We are in our second cohort for that apprenticeship. 2 of our apprentices are now LPNs working for the facility. So very excited about that and looking forward to the 4 additional students that have come through the program and starting the program. The state of Michigan approved a certified medication aid program. There are some basic requirements for that program, one of which is that you're already a certified nurse aide and you have 2,000 hours of care days over the last 2 years in order to sit for the certification to pass medications. We are currently vetting that program. We looked to offering that position in the second quarter of fiscal 26. The other opportunity that we're working on is I'm working on a grant application for an LPN to RN apprenticeship program. And our partnership with West Shore would support that. Right now, we can't offer that. We don't have, West Shore doesn't have funding. We don't have funding to support additional cohorts that would come through. So that's an exciting opportunity if we receive the funding. I'll share what that program looks like. Certainly, we need more LPNs to advance to RN. So that would be not only a great opportunity for our facility, but our community. Currently, our workforce is just over 300 full-time, part-time, per diem staff. Our annual resident patient satisfaction survey results came in. Our core Q results, overall care rating is 94.1%, overall staff rating 94.1%, and overall rate recommendation, meaning those that would recommend us to their families, friends, and the community, 94.1%. Those surveys are anonymous. They're outsourced to an agency called NRC Health. So that isn't something that the facility is surveying independently on their own. Very pleased with the results of our annual survey. ECARS quality measures and staffing rating, 5 stars. And then to share a little bit from the required reporting, year to date, we have received $150,000 from the county. That $150,000 represents an offset to maintenance of effort, which the facility pays. Year to date, the facility has paid almost $120,000 of MOE expense. We have 2 more invoices remaining for this fiscal year. So it's estimated we'll roughly expend the same amount that we did the prior year, which is just under $150,000. The funding is used to cover that per bed tax assessment. And 90% of the residents, patients served by ECARS live in Eaton County. Some of those areas, as you can see, it's diverse. Bellevue, Charlotte, Dimondale, Eaton Rapids, Grand Ledge, Lansing, Mulliken, Nashville, Olivet, Potterville, Sunfield, Vermontville. Other than that, really nothing else has changed on the reporting. Are there any questions for me?
I just will add, Martha sent that report this morning and I uploaded it, but it must not have refreshed when I uploaded it in here. So it is in your packet, it is just not on your screen.
Thank you. Do we have any questions? Yes, Commissioner.
Okay, Marcia, Martha, you went over this pretty fast, so how many of our patients are Medicaid?
Currently, year to date, we're at 75.3% Medicaid census.
Okay, and how many of them are in our long-term of all these patients?
I don't have the number, but I would say based on knowing the financials, generally only 1% of our population is going to be in our subacute rehab facility. So 74% of those would be in our long-term care facility. Generally, our subacute rehab is Medicare Advantage and private insurances.
Okay, so many of our patients that are over there are actually pretty much staying there all the time.
Yes, our subacute rehab has 26 beds. The remaining beds were licensed for 142 beds. The remaining beds are all long-term care beds.
Okay. And do you have all of the different areas open now? 'Cause you were lower.
Yes.
At one time, you brought back one area. and
Yes.
So now you're all fully staffed. Got all the areas open, right?
Yes. During COVID, we had to take 2 of our neighborhoods offline due to many, obviously, community members staying home. And in addition, we just didn't have the staff. So financially, that greatly impacted the organization. So all of our neighborhoods are back online now,
Okay,
and we're fully staffed.
thank you.
On Wood.
All right, do we have, yes, Commissioner.
Thank you, Mr. Chair. Thank you, Martha, for showing up today, and congratulations on the continued 5-star rating. I have a question about the hospice hybrid neighborhood. Could you expand on that, what that is?
Sure. So this unit that was offline was previously long-term care. We found a significant need throughout the, I don't know, I'm going to say the last decade, inside our long-term care neighborhoods. So we developed what we call the palliative care program. So many of our elders obviously passing in place, staying with us because it's their home. So this palliative program, we really expanded and we identified that we could move that program into a neighborhood and provide more one-on-one, dignified end-of-life care. So that hospice hybrid unit, that's what that is. So while we're not licensed as a hospice provider, we are looking at obtaining our Medicare provider number to bill for a hospice service, which does reimburse higher than the Medicaid rate. Currently, those that are residing on our hospice hybrid unit are Medicaid, so we're reimbursed at the Medicaid rate. So what we typically do is we'll transition one of our elders that's placed on the palliative program over into the hospice neighborhood. The staff there is trained on hospice and palliative and can provide the support that they need, including the family members.
Okay, wonderful. So you mentioned short staff during COVID. What do you think has been the contributing factor to being able to acquire the staff? Is it new people coming into the field or people coming back?
It's new people coming into the field. We did have quite a few individuals leave. So what we're seeing, we do have a relatively young workforce now. Historically, before COVID, I would have said many of us had been there for a very long time and retiring out. But we are finding that those individuals are choosing healthcare. Many of our certified nurse aides, their goal is to become a nurse. So they're coming to us, and especially now with these programs that we're offering, the LPN apprenticeship program, well, while you're learning how to be a nurse by shadowing the nurse, as a CNA, this is really assisting with recruiting because they see we have these programs in-house, and within 10 months, if they pass their NCLEX, they can work as a nurse.
That's good news, because I think the whole industry for a while has been struggling.
Absolutely.
Yeah, hopefully this helps. Where does the grant money come from for that grant application for the LPN to RN?
State of Michigan, so civil money penalties grant monies. So nursing homes that receive penalties during their survey process, that returns to the state of Michigan. They keep it in a pot of money, and then they offer opportunities for facilities to apply for those funds to use that to improve resident care.
Okay, wonderful. Thank you.
Yes, Commissioner.
So, when I seen here West Shore Community College, where is that located?
So it's about 2.5 hours away. Yeah, I don't have the exact address. I just know it's about 2.5 hours away north. So it's all online. So, yeah, our students do not drive to the campus. Everything is online. All of their labs, their sims, it's amazing how they're teaching these programs now. And some of these sims, which is virtual reality, I know because I've experienced it. I like to go through these programs with them. It looks real. So everything is online. All of their training is online. The only thing that isn't is the clinical. And so our chief nursing officer became an adjunct professor for West Shore. So she actually conducts the clinicals at our facility. Yeah. Mm-hmm.
Because LCC always has that waiting list down there.
Absolutely.
So sometimes our people in this area go down to Kalamazoo Community College, but when you went to West Shore, that's what made me think.
We actually discussed a partnership with LCC for this program, and they were not ready to roll out a program like this. And honestly, the only community college that is currently doing this is West Shore. And so that's why my goal is to continue our partnership and advance to LPN to RN if we receive the funding. They're looking for $500,000 because they've already invested a significant amount of money in the LPN, in the CNA to LPN program. And they don't have all their seats filled because it's so new. And I think there's a lot of questions. A lot of employers are, and a lot of probably community members are saying, what does this program look like? Is it a valid program? I can tell you it's very successful. And as I've stated, we've already had students that have passed their NCLEX. So I'm hopeful that their seats will be filled for CNA to LPN, so that we can build this LPN to RN program together. So the grant that I'm writing, I'm looking for approximately $1.5 million to help us for the first 2 years of this program, West Shore and the facility. We can't add additional shadow training programs that are not budgeted or not financed. Regardless of our fund balance and how great it looks, we need to reserve, obviously, those funds. We have capital improvements that are needed over the next 5 years. So this grant is essential to continue programs like this, so we're not using our fund balance to seed it.
So when you say that you're on your second cohort, how many are you being able to transfer from CNAs over to the LPN?
4.
4 at a time?
Mm-hmm.
Okay. Okay. Thanks.
All right. Any other questions? Okay, thank you.
Thank you.
All right, next we have the Barry Eaton District Health Department.
Morning, everyone. For those of you who don't know me, I'm Colette Scrimger, the health officer for the next, 27 days maybe. Yeah. So I brought Rebecca Condon here with me. She is the newly named incoming health officer effective October 1. So I thought both of us can come. You can meet Rebecca, and I'll give you my last update to this group. You have in your packet the report that we had submitted last time. Nothing has changed with that report. You know, the information is still relevant in terms of the types of services we provide and who we provide those to. As a health department, we really serve everyone across the district. So, and everyone across the district benefits from our services just based on the type of services that we provide in terms of protecting and promoting health in Berry and Eaton counties. So outside of that, just some other updates that I can provide. We continue to work through the many funding changes that we have been encountering this current fiscal year and looking to next fiscal year, making adjustments to our expenditures while at the same time looking to change revenue sources as well. We are facing a pretty significant gap in funding going into this next fiscal year, and so we're accomplishing that through 2 ways: decreasing expenses and increasing revenue. So expenses are being reduced by a variety of ways, you know, reducing our everyday expenditures on things like supplies and employee training and that kind of thing, but also reducing staffing positions. We've closed 1 full program. We've reduced other positions. I'm taking an early retirement. And more changes are to come in that regard. So the health department will certainly look very different than it has over the last few years. And then we are also looking to increase revenue by looking at our environmental health fee structure, and a proposal is before the board for a 50% fee increase to our environmental health fees to help boost some revenue and fill the gap in the reduction of local appropriations that we're facing come October 1. So the board is still considering that proposal, and hopefully at their meeting on September 18th, some resolution will occur so that we can finalize our budget for fiscal year 26. Beyond that, one of the noticeable changes for the public especially those who use our environmental health services, is that we have closed our offices in both counties to limit public walk-in for just our environmental health services. So it's restricted to 2 days a week that the offices are open in each county. And so we still have staff working 5 days a week. We're still doing appointments 5 days a week. We're out in the field 5 days a week. Staff are working on their work 5 days a week, but we limited that public intake into our offices to 2 days a week in each office just because of staffing limitations. We reduced our clerical staff who normally serve the public that walk in, and with 2 offices to cover, it's difficult with reduced clerical staff to assure that we have that coverage 5 days a week in both counties. And so by limiting that, we can better control and clients can better predict when we will actually be able to serve them. It also allows for some efficiencies with our professional staff because we always had to have one of our sanitarians in the office as well in both counties 5 days a week. And now by reducing the number of days that the office is open, those staff are able to expand the number of field, or the amount of field time they can have throughout the week as they're not tied to being in the office on certain days. So, so that will be a transition. I know we don't have a lot of foot traffic in the 2 offices. It's not a constant flow of people, but the people who do tend to come into the office are regular customers. They're contractors who like to come into the office instead of doing their business online. Most of the work that people do for environmental health can be done online, so that's what we're trying to do, is redirect them to accessing those services that way instead of needing to make an office trip. And then for those who really prefer that office trip, they can come on the 2 days we're open, or if they have a problem with that, they also could call and schedule an appointment to meet with somebody on a day that the office is actually closed. With some of the staffing reductions that we've had, we have seen, timing has worked out okay, just because we've seen a reduction in some services. So I think as with the economy, where it's at now, building is down. I think I saw that in the reports that were submitted for this meeting from your construction offices. So we're seeing the same in environmental health. We're just not as busy as we've been in the past few years. And so timing-wise for reducing some of our staffing, that has been a good timing coincidence. Same within some of our other services. Unfortunately, we are seeing a reduction in the number of people coming in for vaccines, for example, and for some of our WIC services. And so, so that has helped to mitigate the backlog or the pressure that we might have felt otherwise by some of these staffing reductions that we've made over the last several months. So I think that is all I have for you this morning. Before I introduce Rebecca, are there any questions that I can answer?
Yes, Commissioner.
With the way the funding has had to be reduced, how many staff did you have prior, before shutting a program and whatever, to what we're going to now expect, presumably, that the Board of Health will pass on the 18th as of October 1? Like, I remember it was somewhere around 75 between the 2 counties when I was on Board of Health, so I don't know what your staffing is. Right.
Between fiscal years 25 and the budget that the board is considering for 26, it's a reduction of just over 13 FTEs.
Okay.
So we will be the smallest we've been in the 27 years that I've been at the health department, with fewer than 50 staff.
Fewer than 50 staff?
Correct. Across the 2 counties.
Yeah, that's a real reduction. I just wanted to have that count for myself, but also to let the public know, and if they say things like, why are they only open 2 days a week, blah, blah, blah. You know what I'm saying? Because eventually, as people try to get vaccines, try to get with their WIC programs, try to do everything else that they're doing, they're gonna notice it.
Yes, yeah. And again, just to be clear, the office closure, or the office being open only 2 days a week is only for environmental health. Our clinic is still open 5 days a week, though many of those services are offered by appointment anyway, so we don't have as many walk-in people for those kinds of services.
Are you still gonna do like vaccine and flu shot clinics and things around the schools? You know, for the teachers and things like that, that had happened in the past?
That will be unlikely, given staffing limitations, but the demand for that has really dropped off since
Oh.
COVID. So we don't do as many outreach clinics. If a school asks us, we will consider it, and based on staffing and the volume that we think would come in, we will determine if that's the best course to take or not. It's difficult to do full vaccine clinics off-site because of the storage requirements of the vaccines. It's just really hard to transport those. And the accessibility of flu vaccine, for example, is so broad in the community, and even COVID moving forward, it's so broad in the community that it's really better for individuals just to be redirected to local pharmacies or the provider's office than waiting for a clinic at the school, for example. They can walk into their pharmacy today and get their flu vaccine. So it's easier to refer them to that.
Okay, thank you.
Yes, Commissioner.
Thank you, Mr. Chair. Thank you, Colette, for your report. Could you give us a brief rundown of the duties of the Environmental Health Department?
So environmental health we break it into two different teams of work: community services and water protection. So in community services, they are doing things like restaurant inspections, restaurant inspections, day camps, pool inspections. Let me think. Daycares and foster care. And then complaints that we get on a variety of things. And I'm just trying to run through. And so that's mostly community services. Water protection is going to be well and septic systems, both home, for individual homes, and then our type 2 program, which is a non-community water supply. So like your churches and schools that are on a well, or some of your small businesses that are using a well that public have access to. And then our surface water monitoring and our groundwater monitoring programs, and beach monitoring as well. And then complaints are also a part of that, and planning and zoning property change reviews, and I feel like I'm missing, vector-borne mosquito and tick surveillance.
All right, thank you. So you don't, with the reduction, you don't see any cause for delays for new construction inspection and things of that nature?
So it just depends on the demand for services. So back in April, when we were first getting hit with funding reductions and we had to eliminate one of the sanitarian positions, we certainly were concerned that that would be the case this summer, that there would be more of a backlog of appointments and people waiting for permits. But based on numbers we've seen over the last couple of years in terms of demand for services. But as it's turned out this summer, demand has been lower. And so even though we're down a staff position, the demand for service has been lower. And so we have not seen a long wait for those sorts of permits to be completed.
All right. Do you see in the future, and I know your future's limited here, and congratulations on your impending retirement. But do you see in the future the possibility of merging that office in with, say, construction code or some other, I don't know what it would be, some other, maybe conservation district to help share those duties?
So just off the top of my head, no, because our purposes are different. The purposes of that work is really public health driven and needs to be overseen by public health. It's different than just a building code sort of perspective. It's really about what's best for public health. And so you have to have that viewpoint as you're evaluating the services that you're providing. Now, having said that, there's room for partnership. I know other health departments have had those offices sort of co-located so that there can be a little bit more closer collaboration between them. So that's something that is possible, but those services are governed by the public health department. And so they couldn't be moved and overseen but like into the county operations. They have to be under the umbrella of the local health department.
Okay, and then lastly, collaboration with the Drain Commission due to watershed where there might, somebody wants to put a drain field, that sort of thing, or even a well. Do you get good cooperation in that regard?
The only way I can answer that is by saying I'm not aware we haven't had cooperation. So we don't see that as much over here as we do in Berry County. But I am not aware of issues we've had when we've needed cooperation.
All right, thank you.
Yes, Commissioner.
Can you remind, aren't there 8 required services that your contract with the state requires? Can you say what those are again?
Yes, so there's food, restaurant inspections, well, septic, immunizations, communicable disease, STD, sexually transmitted diseases, hearing, and vision.
And those are all still going to be provided with a reduced staffing?
Correct. That's, it's in state law that we have to provide those. It's a partnership between the state and the local health department, a cost-sharing program where both local and the state have to contribute to provide those services, and we are mandated to provide them.
What happens if you get, I don't know, do you get audited or however your approval goes? What happens if you're not doing 1 or 2 of them?
So we have an accreditation process through the state of Michigan. The accreditation happens every 3 years. If we are found to be not providing those services or to be providing them outside of the contract that we have with the state, not meeting the minimum program requirements, then we lose our state accreditation, which means the state can come in and take over or direct us on how to provide those services. And, it's sort of this idea of a state takeover of our local services.
Emergency manager?
Yeah.
Does that happen in the state very often?
It has not happened since the early years of accreditation back in 2003. And even then, when it happened, it wasn't a full takeover. The health department was able to get their stuff in order, from my memory, before the state really had to step in. The state had to work with them quite a bit, and then they finally figured it out and got things together so that they didn't have to have it happen.
So my last question is, how many other things than those 8 is the health department providing now? And when will they stop doing that next year?
So outside of the 8 mandated services, there are also required services that we have to do as well. So, as a public health department, we have requirements written into the public health code, but we also have that are sharing services between the state and us, but there's also just requirements and expectations within the public health code for us to operate as a health department. So there's other things like assuring that we're protecting and promoting health which is a very broad definition of what we need to do. There's definition or requirements around community health assessment and health education around what we have to do as well. And then there's other contractual obligations with the state that we have, that we do as well. And then there's other services that we do because we're the only ones in the district to do them. And so a really good example of that is the WIC program. WIC is not required by any means. We do not have to do it, but it's one of our largest programs. It serves a large number of district residents. And if we stop doing it, the community would be very hard pressed to find somebody else to step in and take over those services. And it would be a big loss for not only those individuals, but our businesses, because our businesses see significant benefit from the WIC program with the, services that they provide and getting paid for those. It's complicated to look at a health department and say what's required or what's not. But at this point, going into fiscal year '26, with the program that we just ended with the Connections program that we just ended, there's really nothing that we are doing that is not required in some way or isn't paid for by outside funding that is covering the cost.
All right. Yes, Commissioner.
Thanks, Colette. I just want to take this opportunity to thank you for your service to Eaton County. What has been 13 years or?
I've been here 27.
Oh, geez.
Yeah. I've been health officer for 13 years.
Okay, that's what I was thinking of. Okay, so yeah, it's been times where it's been tough. I know the last few months with the budget cuts, not just from us, but the federal government, it's been some tough decisions I had to make at the health department. But you also resided over one of the probably biggest health crises we've had in the U.S. during the pandemic. So I just want to thank you for your service and hate to see you go, but we're also looking forward to working with Rebecca. So,
I'll let her come up and introduce herself.
Hi. Hi, everyone. My name is Rebecca Condon. I have been at the health department for 4.5 years. Started during COVID as a community health promotion specialist, and then I was the emergency preparedness coordinator for a time before I became the operations manager. And now I'm really excited to serve as your next health officer. And I'm happy to take any of your questions. Great. Oh,
You're sure?
sure.
Well, we're thankful that you want to step into this role.
Thank you.
All right.
Thank you, everyone.
Yeah, thank you. All right, we move on to item 7, construction codes.
Good morning, everybody.
Morning.
I know you guys all have my report. It looks like we were up on building in all trades last month, so that's good. Do you guys have any questions on the report? No? I'm gonna have, if you don't have any questions on that, then I'll have Brandy come up and go over the DCAs with you guys.
Okay.
Good morning. At last night's Planning Commission meeting, they considered 2 district change amendment requests. One is a map amendment for Eaton Rapids Township to change a piece of property from local business C1 to general business C2. The property is master plan for general business C2. The Planning Commission recommended approval to the Board of Commissioners for this application. In addition, there is a text amendment, DCA 925-3, that the Planning Commission has recommended approval to the Board of Commissioners for as well. Within that text amendment, there are proposed changes to Article 3, which is our administration and enforcement, to ensure that our fee schedule for civil infractions aligns with our fee schedule that was approved and passed for June 1st of this year. There are changes, proposed changes to Article 7, 7.31, the definition for limited agricultural district, to remove the word single-family before dwellings. The purpose of that rolls right into the second proposed change in Article 7.3, subsection 2, which is to permit duplexes as a use by right within the limited agriculturally zoned district. Additionally, there's a proposed change to Section 7.4A6 for low-density residential as it relates to the keeping of livestock, exotic animals, and domesticated animals, specifically to remove the word livestock from that section, which would allow for the keeping of chickens. That's a hot topic item right now that's moving through the legislature, and that could impact our zoning ordinance. So, and then the final proposed change is to Article 14, specific provisions and requirements for 14.27 communication towers, to increase the escrow fee for a third-party review of proposed communication towers. And that's it. Any questions?
Yes, Commissioner, before I start.
Thank you, Brandy, for your report. So just for clarification, chicken aren't livestock?
Chicken are considered to be livestock. That's why we are removing the word livestock from that definition, which would allow for chickens to be on properties that are low-density residential. Currently, the way the structure is for low-density residential for livestock, exotic and domesticated animals is you have to have a minimum of 2 acres plus 1 acre per animal. That makes it very hard for our residents in a low-density residential district to have even 1 chicken.
Okay, thank you for that clarification. I
You're welcome.
appreciate that.
All right, so I got a question. The change of removing single family and allowing duplexes in limited ag. So if you have a parcel that's on a dirt road, right, and you come in and you split it, 20 acres, right? So that's 20 parcels, and then you could put how many duplexes on that?
So the number of splits that are available is actually written into PA 288 of 1967, which is the Land Division Act, and the assessors are the ones that determine how many parcels could be created. There's no formula where you could divide a 20-acre parcel 20 times per the Land Division Act. There would be a mechanism to divide the property through going through the State Boundary Commission by way of a platted subdivision. So if a property, a more reasonable calculation for a 20-acre parcel would be they may have 4 splits available if they didn't put on a private road. They may get 2 bonus splits if they put in a private road or reserve 60% of the property undeveloped. So you're looking at 20 acres with a private road, probably 6 parcels. So that would be 6 duplexes.
Well, 12 families,
Correct.
yeah. And the current infrastructure, you believe that that wouldn't affect the current infrastructure of those areas?
No.
Okay, and isn't limited ag, I mean, you know the rules better than I do, but isn't limited ag, let me change that. Why are we allowing duplex, they're already allowed in R1, correct?
They are allowed in R1, and historically, they have been allowed in limited ag without issue. I have been unable to find why they were removed from limited ag as far as the zoning ordinance committee or the planning commission considering that. We have several duplexes already existing in limited ag zoning, and the only trouble that I have found that they have caused is researching them to make sure that they were approved appropriately. They have all of the approvals from the road commission for driveways, the health department for well septics and drain fields, and the drain office as it relates to how far it might be from a body of water, stream, drain, or wetland.
So what's the difference between limited, why have a difference in between limited ag and R1 then?
R1
If you allow, everything you allow in R1, you allow in limited ag, then why have a difference?
That's a good point. R1 is actually intended, so if you look at Table 7A, R1 has smaller parcels that are able to be created. In a higher density rate than what you could in limited ag.
So the parcel size now, if this is approved, well, it was approved by your board, but if it's approved, then the only difference in between the two is parcel size.
Parcel size and lot coverage, yes.
Okay.
Randy, what is the minimum parcel size in a limited ag zone?
0.83 of an acre.
And what's the size in R1?
Off the top of my head, it's dependent on a few different things. There's a slide.
Generally, half an acre, 0.5?
Yeah.
But R1 would typically be in a place that has infrastructure, so they're possibly, or probably on some type of water source, not on a well and a septic.
So you're referring to
R1.
public water?
Yeah,
Within the county jurisdiction, no, that's not typical. Most of the properties in Eaton County only have well, septic, and drain field. I don't know of any local cities or villages that allow for the use of their services for outlying
correct. Yeah.
jurisdictions without annexing it.
Yeah, what I was saying is there's a R1 zone property.
Would
Would-
still have well, septic, and drain field.
Okay. Okay. Any other questions? Oh, yes, Commissioner.
Randy, thank you. I read something about, actually, I had missed that they had increased it from 3 in a 10-acre split, and it's currently 4, but they're still looking for it to be able to be split, I think, 5 times now?
Are you referring to the Land Division Act?
Yeah.
The last time the Land Division Act was updated was March 31st of 1997.
Yeah, I think it's right now being looked at.
It's being looked at, but nothing concrete or
Correct.
forward.
Okay.
So, and the number of parcels given, so there is a formula written within the Land Division Act,
Uh-huh.
but it's only an assessor can tell somebody how many parcels they have available to create properties.
Okay, and that's every 10 years, right? So if you split it now for 4 parcels in 10 years, then do you get to split again after the 10 years?
In theory, but again, that is up to the assessor.
Again, okay. Okay, thank you.
You're welcome.
These are action items?
Yes, they have resolutions with them, both of them do.
Okay, so,
I would vote on them separately.
yes, we are. All right, so I would take a motion for 7 Bravo, which is DCA 9-25-2. That's the map. Do I have a motion? All right, seeing no motion. All right, moving on to 7 Charlie, DCA 9-25-3, which is all the text amendments. Do I have a motion?
Is that's the one where we're going to allow the R2s?
The duplexes in limited ag, yes.
Okay, I make a motion to go ahead. We need housing.
Okay, I have a motion. Do I have a second?
Support.
I got a support. Okay, all in favor,
Sure.
yes, Commissioner. Yeah, excuse me, open it up for discussion.
Thank you. Had trouble finding this, the wording on this. My question is, in this, and I know it was allowed in the past and it was removed from limited ag, but the question is, does it necessarily have, this resolution we're speaking of right now, have to be in limited ag? I can see a few issues coming up with this. I'm assuming, and don't get me wrong when I say this, I'm assuming this would include low-income housing, is that correct?
Zoning would not have any say on the economic status of a housing development.
Well, I'm just thinking of areas outside where municipal water and septic are available, and to get multifamily dwellings in place, and up to how many, well, I guess that was up, the parcel size was the issue. But could we get an overconcentration of this type of housing for infrastructure support, like well and septic?
I am not concerned about that because prior to being able to get a building permit for any structure, they're going to be required to get the approval of the health department. So the health department would first have to review what is proposed to be constructed and determine if there is support for the appropriate well, septic, and drain field that needs to go on the property before we would issue a zoning referral or a building permit.
Okay, I still have some concerns about this, but thank you.
Any other discussion? Okay, so I have a motion and a second on the floor. All in favor of 7 Charlie, signify with aye.
Aye.
Opposed?
Aye.
Aye. So it looks like the opposed went, so it was not approved. All right, so are we moving on to 7 Delta?
I would ask for a motion on the map amendment, again, to make sure that.
Okay.
That they really don't want to take action on that, because it has to have action to go to the board.
Yes. Okay, so per recommendation of the admin staff, I ask is to revisit 7 Bravo, which is the map amendment in Eaton Rapids Township. Do I have a motion? I'll move it. Do I have a second?
Second?
All right, so I got a second. This is for, I'm just restating before I open up for discussion, 7 Bravo is the map, a map amendment for zoning, commercial to, or,
Local business C1 to general business C2.
okay, thank you. Open it up for any discussion. Any discussion? Oh, yes, well, yes, Commissioner.
So my comment's not a part of this committee, but being sitting in on the meeting last night, it concerns a business where he's only able to continue to expand or it changed ownership and he can't have use by right or however that's worded from the previous conditional use. So he's basically, that building will be nothing. It's where P&K, where they sold the trailers, camping trailers. So the supervisor from Eaton Rapids Township was here, and they very much in favor of this, being able to use that as a business and keep that going.
As Brandy stated, it is in the master plan for this property to be C2, which is what they are requesting.
Okay. Do we have any other discussion? Okay. Then all in favor, signify with aye. Aye.
Aye.
All opposed? Signify with aye. All right, ayes have it. So 7 Bravo is passed. That's the map amendment. Okay. Now we're moving on to 7 Delta, the contract service update.
So we, excuse me, we had a meeting on the 26th of August with the townships. We've put together the intergovernmental agreement. We had some good discussion with the townships. They're going back. Brandy and I are having more discussion with their boards. Brandy and I are planning on making some contacts with them the end of this week, first of next. I know we've got, I believe, 2 of the townships that already said that they were gonna sign the agreement. Is it 2 or 3? Oh, Brandy says 4 now. So, we're hoping that by the middle of September, we'll know if all the townships, the 11 townships are on board. If for some reason one or more of them are not, we're gonna have to sit down with the remaining townships, with Connie and Ben and Jim, and have more discussions, because that's obviously gonna change the financial standpoint. That's where we're at with that for right now.
Do I have any questions on this?
So, if I can
Yes.
just, so what we're asking is for the board to approve the agreement, and then the townships can sign on. But if this board doesn't agree to that, we won't meet again until October. Therefore, we would be behind in the game of getting this done for the townships and for the county. So that's what we're asking, a recommendation to go from this committee to the board for approval and then see where we go. So there's a lot of discussion at the township level, looking at what they want to do, what they feel. You may have seen there was something that went out from Eaton Township, that they're doing a public hearing on it. So who knows what'll happen out of that. And there was really good discussion, like Chris said. It's just they have their own concerns.
Yes, Commissioner DeRoche.
Thank you, Mr. Chair. Chris, this $15,000, it's mentioned this is the absolute maximum amount that a township would spend for these services
In this 3-year agreement, yes.
in the 3-year agreement, and then what?
Then we're gonna have to just reevaluate. I don't think Brandy and I either one anticipate that changing. The variables are if townships drop out, but maybe a township that we're not doing right now wants to come back. So that's part of the reason, and we had that discussion with the townships of why we're doing the 3-year agreement, to give us all a chance. Brandy and I, our anticipation is that after the first year, that they won't have to pay that $15,000, that it would be less. But there's so many variables, depends on how the fees come in for the zoning referrals and all of that, and the conditional use permits. So until we do it for a year, we really don't have any idea what the actual number is. We know we need the $15,000 to pay for Tammy and Brandy and what they do for the zoning. And also keep in mind, in that intergovernmental agreement, the construction code is paying 50% of Brandy's wage and 50% of Tammy's wage, because they're also working for the construction code department too.
Okay. So you said you've got 4 townships on board. Does that at the exclusion of our charter townships? So you have 4 general law townships on board?
Yes.
Okay, and will this agreement apply to any of our charter townships?
If a charter township wants to come under our zoning, yeah, they can.
That would be a different contract.
Yeah,
Okay, but the cost would be the same?
No.
probably not.
So under Section 3, compensation, Section A, there's the clause of an addition of communities mid-contract. So this was done in the event a city or a charter township wanted to come on board, given the fact that some of them have expressed interest. But we can't do anything that is going to jeopardize what we've already indicated to the townships that we're doing planning and zoning for. So that's where the 15,000 has come in. That was a number that essentially was thrown out there. We're committed to that. But if, like Chris said, the numbers come in less and we don't have to charge in a future year, then we won't do that. Alternatively, if the numbers come in higher and the cost is greater, the county is going to have to pay the higher cost. And then we'll go through that 3-year period, and in the year prior, we'll figure out exactly what the townships would need. So it goes both ways. But running into doing all of this and some changes that we have to make with staffing, which we'll discuss after this, and the change in classification of positions related to construction code, giving them an exact number, and the fact that we raised fees was really difficult. And when they went around and talked to the townships, 15,000 was what was indicated. I can say that during discussions, there was requests for services based on how many things occur in their township, right? So there was a lot of discussion there. There was discussion if we went via SEV, via parcels. So there was a lot of discussion. What we had to rest with was 15,000 for each, and then to go on from there. So there had to be some basis for everybody to join in. Now, if a township, like Chris said, does not want to do this, opts out of it, the one thing that we'd like to know is the board agreeable to then going back to the other townships and talking to them, obviously raising their costs to meet what our costs are. The discussion came up. It was something that, as staff, we're agreeable to do that. The board obviously would need to make the decision on that. So again, this contract and the availability for them to join in is where we need to start. Then that would be the discussion after. Did I miss anything?
Okay, well, that was one of my concerns is, and I will use the term hypothetical so as to not name any of our townships, but if hypothetically we have a township that says they can't afford this, will we have some kind of fee schedule for that particular township or any township that doesn't want to participate at this level to still have services rendered by your department without that $15,000 upfront cost?
At this time, no, we don't, because that $15,000 cost per the 11 townships is what it's gonna take. As we stand here today and what we know is what it's gonna take for that planning and zoning department to continue to function the way it is.
So there's no way for a township to partner with a different township to get services without paying $15,000 upfront?
If they did, that would have to be something, in my opinion, that those two townships would have to work out amongst themselves.
Okay, so it is feasible, it's just not on the table at this point.
Yeah.
All right, thank you, Chris.
Yep.
Yes, Commissioner.
I don't understand some things because I'm from Delta Township. We have our own planning and zoning forever. And I know where the office is. But so in this situation, when you have a charter township, don't they have to already have some type of planning and zoning? If they're considered a charter township?
They do, but from what I understand, they can still come under, as a charter, they could still use our planning and zoning services.
So that's what's been going on with other,
Right now, we're
Charter
not doing
townships?
any no charter townships we're doing the planning and zoning for as of right now.
so they're right now doing their own.
Right.
So it's just like Delta, right?
Yep, so like Windsor Township, they do their own planning and zoning. Benton Township does their own planning and zoning. And they're both charter townships. Oneida Township also does their own planning and zoning.
So technically, we don't have any expectation that they wouldn't continue on that way, doing their own planning and zoning for their own residents.
Not right, as of right now, no. I don't have any indication that any of those that I just mentioned would want to come under us, but they do have that ability to come under us for planning and zoning.
Okay, yeah, I remember things that have come up in the past several years.
So the 11 townships that we do planning and zoning for right now, none of those townships are charter townships.
Okay. And they're the ones that meet on the planning commission for those.
Yep,
Like last night.
yep,
It was on YouTube.
yep.
Okay, thanks.
I have it. Okay, yes, Commissioner.
I'm just wondering, that is the 15,000 I hear, that's the top limit, but under the contract agreement we have, you know, in general with everybody, there's a 15% admin fee. Is that in the discussion, or where does that fall in here at all, maybe?
So again, when these discussions occurred, it was before that 15% was, well, it was right kind of in the mix, so it was not included. Little frustration in how this all came together, but again, this is a big thing for the county to not offer these services where we have. So the 15,000 will cover that 15% admin fee. So it will for the 3-year period. Now, the other thing within the contract that I should have mentioned before is an annual reconciliation. So we modeled this contract financially after the Delta Township Police Services contract, because our goal is not to, make money. This is gonna go in a separate fund, and it's supposed to fund itself, obviously, and consider the fact that revenues may be over expenditures and not charge these townships more for the service for the county to build a fund balance, right? That's not the intent here. So we had lengthy discussions with the township about that, and I'm very confident that we'll be able to work that out after the first year.
Thank you.
I got a question. I don't know if it's for you, Chris, or the admin staff, but during these discussions, and maybe I missed it in this service contract agreement, is there any discussion about changing the makeup of the planning board and planning and zoning boards, whereas these charter townships, if they're paying for a service, they have direct representation on that board?
So right now, everything would stay the same because we're not changing the makeup. Even if one of the townships that we're serving right now drops out, that wouldn't happen. If we were to expand and provide services to charter townships or cities, again, all of this has to be revisited. So this is a challenge in and of itself on the basis of representation. Just because everybody wants to make sure in the townships that now that they're paying for the services, they want to make sure they're being represented. So is that potentially going to be a topic of discussion? I think it's likely. We did have some discussion on the 26th when we met with the townships. But as of right now, nothing is changing service-wise. Did I miss anything, Brandy or Chris? Okay.
But what's the number, how many people you gotta sit on the planning and zoning board?
9.
9 on the, I'm not worried about the DBA or anything, just the planning and zoning, there's 9 members? Okay.
2 of which are commissioners.
Yeah. Okay. All right, do we have any other discussion? And that is an action, right? To move
Please,
forward?
yes.
Correct.
Okay, so, that is the move, I'll make the motion, but it just make sure I'm stating it right. So this is a motion to, agree with this, to move it to the full board, so we can get moving on with this.
Correct.
All right, so I made that motion,
So,
and I got support. All right, so I got a motion of support on 7 Delta. All in favor, signify with aye. Aye. Opposed? All right.
So
Oh, you want to,
just due to the financial
Okay.
aspect of it, let's do that.
okay, well, you could have told me that before,
Well,
then I would have made the proper motion.
I was trying to streamline it, but Ben had to
No.
muddy the water, so.
No, all right. You got to always double check the admin staff, I guess.
Yep.
All right, so I make a motion to move 7 Delta to the Ways and Means Committee. Do I have support?
Support.
Okay. Now, all in favor, signify with aye. Aye. Opposed? All right, so that will move on to the Ways and Means Committee. Okay. All right, so we're to your restructuring.
Yes, and I'm asking you guys today, and I'll clear this up for you right out of the gate, to send this to the Ways and Means Committee for consideration. I'm asking to reclassify my planning and zoning administrator and code enforcement officer to deputy director, my permit specialist and planning and zoning assistant to planning and zoning and permit coordinator, and my permit specialist to zoning and permit specialist. Which that third position right now is not filled. I'm hoping to fill it very, very soon. I waited to see what was gonna go on throughout the county, because maybe there was someone that could come into my office that was let go from another position. So now that the majority of that has been worked out, I am going to put it out there for applications to be applied, probably next month. We're a little bit busy right now, so it's hard to train somebody when you're going 100 miles an hour. But this reclassification for these 3 positions, before my time, our staff has been cut 2 or 3 times. So, and that has put more work on the staff that I have. And I am out of the office the majority of the time doing my inspections and code enforcements and things of that nature. So turning the planning and zoning administrator into a deputy director will allow me to have someone in the office that can take care of the day-to-day things. And then moving my permit specialist and planning and zoning assistant up to a coordinator, that'll allow her to do more of the planning and zoning. And then the permit specialist will just still be a permit specialist, but she'll also do the general zoning referrals.
Do we have any questions? Yes.
What does the planning and zoning permit coordinator coordinate other than the specialist?
So she would do, in moving her to that position, she would do only the commercial permitting, which is more in depth than residential permitting. And she would do more of the, like, DCAs, conditional use permits, site plan reviews, Board of Appeals applications. So that would take some of that off of Brandy so that she could do more coordinating and have more time to coordinate and work in the office.
Yes, Commissioner.
We just had something at a prior meeting. We just had something at a prior meeting that when we move them up to deputy director position, it affects our budgets.
Right, it does. So what Ben, HR side of Ben, is going to work on is getting this information to a consultant that we use for reclassifications with the new job descriptions. So that will happen. It'll be classified based on what the result of that study is for those positions. Now, I want to emphasize here, and Chris mentioned it, that the positions are split between construction code and planning and zoning. They currently are right now, but it's only 2 positions that are split. This is not the result of us cutting the budget, looking at doing away with planning and zoning, doing the planning and zoning at a cost for each of the townships. This is truly the result of changes within construction code. So, as Chris said, being out of the office, he needs somebody running the office. I will say that Brandy is currently acting in that capacity. So we haven't reviewed it. When it was initially reviewed about 2 years ago, that was not included in the job description. So now Ben has worked with them to go through the job description and ensure that Brandy's classification meets exactly what she is currently doing and will be expected to do. And then the planning and zoning permit coordinator, that's essentially taking the responsibilities that Brandy does, boom, 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 on a daily basis where she's just going. So that will be classified to do that. And then the backup to that will be the specialist. So that's what we're looking at. But yes, it is a greater expense as the deputy director, but that will be more on the side of construction code.
Well, my question here is just looking at the org chart here, right? So the deputy director falls under the director, which you're paid out of the construction code fees, right?
Correct.
Okay, so, and then that deputy director, though, their direct reports are in the planning and zoning. So where's the funding coming? What funding source is paying for the deputy director? Is it construction codes or is it coming out of planning and zoning money?
Right now, the way it's set up is Randy and Tammy both are paid 50% from construction code and 50% from planning and zoning. I assume that will stay the same.
This is because it intersects with the other work that's going on, but whatever that ratio is will be formalized going into like a contractual relationship with townships. But right now it's 50-50. And then I believe moving the permit specialist would be, is it 25 would be paid by planning and zoning, 75 by construction codes? So that would be the order. The other thing with the job descriptions, which will be in the Ways and Means packet, you'll see we've separated out the job duties. So if these departments ever become separated again in the future, will be easy to do so. So we've segmented the responsibilities between each group. As it sits right now, those 3 positions exist. It's just the current role that Brandy's playing is not considered a deputy under the classification we did a couple years ago. And then it has the permit specialist for construction code and the planning and zoning with less overlap. We're merging, essentially, you have support staff and inspector staff to try to consolidate and get some synergy efficiency out of the staff that you have.
And that's support, sorry, Mr. Chair, and that's supported then by the fees or the contract in the future?
Yeah, so from when you go to Ways, that's what you'll be looking at is 50% off the top is going to be paid by construction code for the 2 positions and then 75% for the 3rd position. So from a general fund, you're looking at 50, 50, 25. Then from there, you would have to take into account how much fee revenue is coming in to planning and zoning, because that's the general fund portion of the equation, which they talked about earlier. They don't really know what the forecast of that would look like. So when we do our first year of reconciliation, you'll have a much better idea how close that revenue plus the 15,000 from townships is going to be enough to cover the cost of the department. So that'll be a part of our first year look back, is how close they got to hitting it.
So what part of this are you asking us to approve or vote on today versus Ways and Means?
I've been corrected. It's no longer going to be considered general fund in the sense because it will have its own dedicated account, but it's still not restricted in the sense like construction code is statutorily restricted. Yeah.
And to answer that question, which was about what are we doing today, this board, this committee needs to agree to a structure change like this, going to Ways and Means for the financial piece of it.
So policy approval to go to financial considerations at Ways.
Commissioner Gross.
Thank you, Mr. Chair. This question's for Ben. Ben, in the changing of duties and responsibilities here, do you see any potential conflict in this change?
So we did have some of those discussions. So for instance, complaint procedure is important, especially in a service department like this. So the primary focus for complaints, for instance, it wouldn't be appropriate for Brandy to process a complaint about herself, right? So those will still reside with the director. And then similarly, if residents have complaints against Chris or Chris and Brandy, right, those need to come to the controller's office. So that was part of what we looked at, is we wanted to make sure that we kept the complaint procedure alive and well, because you need that in a service department to resolve concerns that you have from citizens.
And that won't cause any problems with the person that's filing the complaints, just a matter going to be directed to a different.
Not at all. I mean, we've tried to have those discussions because, you know, everybody's got to do work on their deck, their roof. At some point, this is an area of government that almost everybody comes into contact with. And so it's important for them to be able to voice concerns that they have without fear of retaliatory action. I know the department's committed to that, and I know you as commissioners, you have people approach you, and us at the controller's office is also committed to that. In fact, we've done the work of looking into concerns that people have had, and a lot of times it's an education piece, and sometimes it's a conversation piece with our team. You know, we're all human. We can do better, and we do better, so.
So now that brings the next question is, who are you going to elevate in your office for this? And do they get paid on construction code, or how's that work?
We're just going to do a per diem billing. No, kidding. I mean, but honestly, I really appreciate the question, and structurally, I love it because this is how we've been, as we've approached parks, as we've approached this. We've tried to talk about capacity, and you're right, like our office is still a struggle bus. So hopefully in the future, we can bring that for you to consider. But I mean, Connie was here till almost 11 o'clock last night.
Oh, no, it was later than that, but thank you for
She was
recognizing
emailing
it.
till 11. She's still here.
No, this is part of the discussion we had with the 15% admin fee and the challenge that we're having within our office. That is a standard practice. But I will tell you, this committee, Ways and Means, and the board, there is a challenge at when does that trigger something occurring within a department that provides services. So we need to put that together. In the Delta Township contract, we specifically identified, right? 5% was going to go to MERS. Well, I want to say it correctly. Of the 15%, 33 is going to MERS, 33 is going to sheriff admin and technology. It was really defined within that. Basically, when you're looking at an $8 million expense for a township, you know, you're going to look very closely at that. We put that together within this contract, but again, we're falling into a situation that we're already doing the Delta contract. We have more work to do now with that. We're already providing these services. The complaints could be greater. The expectation from the townships could be greater. I mean, if they're paying for it, they're going to want them at their meetings. They're going to want to ask questions. They're going to listen more to their residents. So again, at some point, we're looking at when it triggers something within our office. And we're drowning right now. So Ben takes the complaint, you know.
Not talking about the comptroller's office.
No, we're not.
I'd just
Okay.
like to say that Connie mentioned the complaints and going to the meetings. Brandy and I do go to the meetings. We don't go to every one. We try to go to a couple township meetings every month. And we have, I think Brandy and I both feel that we have great relationships with these 11 townships. None of them hesitate to call and ask questions. So, and when they do have an issue, we've made it a point to go to that next meeting that they have and have face-to-face discussions. So that's something that we already do and we plan on continuing doing. I just want you guys to know, as everybody else in this building, we are short-staffed. And I'm trying to set this up so that my entire department is cross-trained. And when I'm out of the office, nothing changes. Brandy and I communicate when I'm out of the office constantly, sometimes more than I'd like. But I want you to know, you know, it's like my building inspector, Chris. I ask him to get his building official license because if something were to happen to me, you guys need a building official for the county. And he went out and got his building official license so that you guys and my office have a second building official, so that if I get hit by a car or you guys fire me tomorrow, you guys have a building official. So that's what I'm trying to set the department up. Even though we are so low-staffed, I'm trying to set it up so if one of us is missing, the wheel keeps spinning.
Okay. Any other? Okay, seeing none. Do I have a motion to move the restructuring of the Planning and Zoning and Construction Codes to the Ways and Means Committee for consideration?
So moved.
Support.
All right, I got a motion and support. All in favor, signify with aye. Aye.
Aye.
All opposed? All right, that moves. It passes. All right, thank you
Thank
very
you.
much.
Have a good day.
All right, we're moving on to number 8. Recycling. That's not your fancy name, but.
Good morning, Commissioners.
Morning.
Just general updates. We're continuing with moving forward in the new budgetary environment. We're looking at all of our next fiscal year programs and looking really at our core operations, including rewriting the materials management plan, administering and enforcing the solid waste ordinance, operating county collection programs, working with local recycling centers, and engaging in education programs around the county. Other updates, all of our reporting, solid waste ordinance reporting, we had to work with a couple of the haulers, but all of them are brought into compliance and we are in good shape there. We just completed event season for county projects and programs. Recycle Palooza was a huge success. Our registrations were up And there were some concerns with reducing from 3 events to 2 events, but I wanted to get into the report, our collection summaries, but sometimes it can take our vendors up to a month. I got one of the reports this morning, and from all of our numbers, it looks like in total, we have over 100,000 pounds of hazardous waste, electronics, and tires that our programs have removed from the environment here in Eaton County and properly disposed of. And compared year over year to previous years with 3 events, we are actually in really great shape. So I'm looking at doing more of an analysis, but we were only down 10% in weight compared to the previous year with 3 events. So we would expect a 33% or so reduction. So the department's working really hard with changing how we operate the events, making them more efficient, and the numbers are definitely showing that. So, and with the events, just a special thanks to the Eaton County Road Commission for allowing us to host on their site. The Charlotte Lions Club, the Controller's Office has been extremely helpful. Eaton County Parks, the Conservation District, the City of Eaton Rapids, and just the community here really make these events possible. Other updates, we're looking at some of the hub and spoke model in the Sunfield Recycling Center and the recycling trailer. We are working these into a very nice program, and for the current fiscal year out of Sunfield Recycling Center, with our collections programs, we have a gross revenue of over $20,000 already, and when once we get through to closer to the end of the year, we're going to be doing a more detailed analysis, and then all of the data that we're collecting, we're going to be leveraging for infrastructure grants and other programs. So we're going to be applying for EAGLE and looking at other grants for developing more recycling centers, infrastructure in Eaton County in partnerships with a lot of our municipalities. So we're looking at Bellevue, Olivet, Eaton Rapids, Vermontville, and other communities where we can leverage this information. So we're really happy with the direction these programs are going. Education, we've been talking with our haulers, what problems they're having with residential trash pickup and some misunderstandings. And we've been talking with residents about their recycling programs. So the department, I have an education background, and so I'm really looking forward to narrowing it down to Recycling 101 and Composting 101 for both adult and youth audiences. So adults more geared towards libraries and community organizations, and then looking at going into the schools and talking about recycling and composting 101 with the schools. So we're really looking forward to that. And finally, with the materials management plan, we have our meeting next Tuesday, and we're going to be outlining the goals and objective of the materials management plan, which will be facilitated by myself. And we are still waiting on the grant agreement from EAGLE. So we are currently working on this mandate without the necessary financial assistance. So as soon as the department gets that grant agreement, we will be very happy and be able to move forward with some of the planning work that's being mandated of us here at the county. And finally, we have some updates to our battery program. With our battery program, there's historically alkaline batteries have been considered toxic waste. They have certain metals and certain components in them that the landfillers, they don't want them, the haulers don't want them. And so we would have special collection programs for those. With the technology and the development, alkaline batteries are no longer considered to be toxic and hazardous waste. They've cleaned up the metals and a lot of the other components of there. And so if you look at guidelines from EAGLE, you can throw away alkaline batteries. I think that's going to be a shock to some of the community because over the years we've gotten very conditioned to recycling batteries. But in light of budget concerns and really focusing on programs that people need, we would like to look at redoing our battery program, focusing only on lithium-ion batteries. And those are the rechargeable batteries that you see in absolutely everything now. And as you're probably aware, they regularly cause fires, warehouses, landfills. The other day, I saw a dump truck on fire from one of these batteries. And so we would like to look at focusing on lithium-ion batteries. And with that comes some safety concerns. So we would like to be purchasing, looking at our battery program, no longer taking alkalines and using that extra funding. And that's over 50% of the cost of the program is recycling the alkaline batteries. And we would like to purchase fire-safe cabinets that will, as we continue our collection programs for lithium ions, we will be doing it in the safest manner possible. And beyond that, changes to the program, working with our recycling centers and local community groups and entering into MOUs. Currently, with our battery and some of our collection programs, they're relatively informal, which can lead to disputes and misunderstandings. So I would like to see the department formalize some of these agreements through MOUs in the next fiscal year. And so those are some updates to the battery program that we're looking to doing for next year.
Do we have any, yes, Commissioner?
So, when you convert from alkaline to the ion batteries, are you thinking that each collection site is going to be taking those in? Or are you still, will you have it at the 2 annual big paloozas?
Yes, so currently we collect batteries with our mobile recycling trailer at our 3 locations. And then the other recycling centers, Cara and Delta and Grand Ledge, they're a part of our battery program too. So they collect the batteries from their centers, and then we schedule and coordinate and administer the pickup through our vendor. And the county currently pays for all the community's battery recycling for all the centers.
But are you collecting our rechargeable batteries?
Yes, we are getting lithium ion and rechargeable batteries, yep.
So far, I've had good luck and they're still alive.
Oh.
So I haven't run into that situation. I'm just trying to figure it out since they are more of a hazard. So I'm trying to figure out how we would be doing this if we have a whole bunch. I mean,
Well, the one of the main safety factors that we're going to be implementing is you have to tape both ends of the terminals, because if they're in a pile and they're in series, they'll start running an electric charge, and that's what ends up starting the fire. So if we tape the terminals, so it's going to be a little extra work with the community, just training people. If you want to recycle batteries, please tape the terminals, and that will take care of almost all of the hazardous situations. But there are limited situations where the batteries will expand and get hot and potentially start fires. But by taping the terminals, we're looking at reducing almost all of that risk.
okay, thank you for telling me that. The other part is, with the state budget the way it is, you have referred a couple of times right now about, the putting in for grants and things like that. Do you have any concerns, since they can't figure out how to get a budget, that some of those grants that in general, do you think might go away?
I do think there's a risk. I've been following the state of Michigan budget process very closely, and it does appear that there are cuts to Eagle, I think around 10 million or so to Eagle, including staff and programs. I do believe that our MMP program for Eagle is funded, and I'm sure they're looking at making sure they have funding for that for the forthcoming years. Otherwise, we're very concerned about infrastructure and some other grant programs that these communities really need. So I'll be following it closely as they work through their budget.
Okay, I guess those hadn't come on my radar because I'm more on the human services end of it. So I've been watching those type of possible cuts and grant availability. So, thank you.
Yep, you're welcome.
All right, yes, Commissioner.
Thank you, Mr. Chair. Thank you for your report. I just wanted to touch base on a couple things really quick. How did the Recycle-Palooza go?
Recycle-Palooza, it went really good. We recovered about, let's see, spreadsheets are, it's hard to find some numbers. About 45,000 pounds of materials for Recycle-Palooza, and we had about 800 registrations, and typically there's about a 25% no-show rate. And so that's something I'm looking at adjusting, but we did have over 600 people show up and participate in the Recycle-Palooza.
So I know we were there at like 9:30 or something, and the line wasn't very long, but then when we left, it was way out.
Oh, yeah.
So would that be something in the future? Because I know people were still asking on Facebook that day, how I tried to call the number, how do I still get there today? I mean, the day of, would that be
Right.
something that because of the no-show rate that you could incorporate at the end of the day, maybe if you still had open spaces, people could utilize that?
Yeah, we're looking at ways we can address that. Our issue, we have a staff of 2 and we're fully staffed at the event, and so we can't be answering phones and emails the day of as we're running the event. What we have been doing, we're allowing registrations to go over. For example, we have 1,000 limit for each tire trailer, and we have 2 trailers, so 2,000 is our limit, so we're following the numbers, but we will, because of the no-show, allow up to 2,500 registrations for the tires to account for those no-shows. So we do allow over-registration for certain time blocks and for the total event to help account for those no-shows. And as far as people signing up last minute, that would be very difficult for our department to handle.
Okay.
Yeah.
And speaking of the tire portion, I do have people reaching out asking because they didn't get signed up for the event or didn't know about it. Are there any local recycle centers within the county that take tires on a normal basis, or is that only a once in a while type thing?
There are some services, but typically it's about $5 to $10 per tire people will be taking in. And at those costs, deters a lot of people. And it's one of the reasons why our events are so popular, is because through an Eagle grant, we're able to not charge the community for disposing of their tires. So there are other locations, and if they contact the department, we'd be happy to talk with them.
That's what I did. I gave them your
Yeah.
number and asked them to please reach out to your department, just because I wasn't sure where to direct them, so.
Yep. So there's just fees usually associated with recycling tires for other organizations.
Perfect. And thank you to all the volunteers that were there that day. They were wonderful in helping everybody while we were there, as I said, transition and get through quickly and get to what area you needed to be in. So
Yeah.
that was nice.
Thank you.
Thank you.
All right. All right, well, thank you.
All right.
Oh, excuse me, Commissioner.
Yeah, thanks for that successful Recycle-Palooza. I was able to get some tires off my hands. So, but I want to point out that it's success because of the work you're doing and getting it out there, but also for us having Logan Bailey and a communications director and the ability to get that message out. I think that is a huge part of the success where we didn't have that before. So I just want to make sure you get that. out there. But it's well-run. You get in and out, and it's a good experience for everyone that attended.
Thank you.
Thank you
Thank you.
very much. Moving on to parks.
Morning, Commissioners. So we've got a pretty big report today. This past month, I met with a representative from Designs by Nature to discuss restoration efforts out at Crandall Park, turning that back into native prairie in the coming spring when we eventually put a road in off of Flanders. I've been working with Technology Services to get in and out at the Fox Observatory. In doing so, this will just allow the group that does programs out there to enhance what they're already doing. We just got confirmation from Smart Home, Smart Offices that they will be installing the last 2 monitors out at our Lincoln Brick Nature Center on Friday. Once those are in, we just have to finish up a few of our plaques, and then we should be ready for a grand opening. Right now, or a couple weeks ago, Clara Alderman and Ben Youngs and I attended a meeting with Smart Home, Smart Offices to learn how to use some of the programs associated with these new monitors. And right now, Clara is currently working on formatting our touchscreen elements. So those interactive exhibits will be up and running when the center is open. This past month, we also installed 6 Trafix trail counters. So these trail counters will help collect data on park usage, which trails are being used the most, where people are spending their time on the weekends. And all of that information can then be used when we decide to go out for grants or when we report out to you guys, or sky's the limit, really. They'll inform our budget process, things of that nature. If you look on page 3, 4, and 5 of the report, you can actually see some of the graphs that we've produced already for the month of August. So you guys get an idea of what that program can do. We're still working with Natural Capital Forestry to prepare for our Lincoln Brick Park strategic timber harvest. So all of this is going to be done through the American Tree Farm System. So Lincoln Brick Park recently got designated as a community tree farm. And what that essentially means is that we're going to be following all the standards laid out by the American Forest Foundation. And it shows our commitment to make sure that even though we're doing this strategic harvest, the goal is not profit. The goal is to foster biodiversity within the park and just boost our ecological functionality. So in the long term, it's going to help move that park more towards an old growth forest, which is what we have been trying to do for a while. Events and programming. Right now, Clara is working on getting all of our advertising out for our upcoming fall events. So the main 2 events that we have coming up in October and November are our Timber Trails 5K in Fitzgerald Park, and then the Pumpkin Chuck on November 1st. This year, the Pumpkin Chuck has expanded to include 3 new stations. That'll be the Pumpkin Dunk, the Pumpkin Smash, and the Pumpkin Hunt. And the reason for doing this is just to encourage people to purchase more of the pumpkins that we get donated from some of the local farms around. And it's just a way for people to have more fun at the event. Okay, August events, we participated at the Grand Ledge Summer Reading Finale on August 6th, the Grand Ledge Goulash Fiesta at Oak Park on August 23rd, and the Charlotte Summer Concert on the Square on August 28th. and those were all rec trailer events. In September, we will be doing a campfire science and s'mores with the Grand Ledge Library, focused on trees and the different species that we have at Lincoln Brick Park. That'll be on September 13th. We will also be taking our rec trailer to Woofstock on September 27th at the Charlotte Courthouse. And we will also be participating in the Helping Hands Food Pantry Third Annual Harvest Gathering on September 27th. Operations update. The project list has been updated. That has been included in the packet, so you can see all of the projects that were completed this summer, as well as projects that we are going to continue to be working on throughout the fall and winter seasons. At Fitzgerald Park, progress is still being made on the stairs. Right now, at the latest, the projection is that the stairs would be done mid-October, but it is likely that they would be done sooner than that. There are more recent pictures of that progress in the back of the packet as well. Completed projects in August. The Fitzgerald Park office was re-roofed. The automatic locks have been installed at the Fox Park restrooms. Dead standing trees have been removed from Butler Park, and 5 new saplings were replaced at Butler Park for that reason. And then 4 dead standing trees have been removed from Fitzgerald Park. Current projects, Ben and his team are removing dead limbs from trees around Fitzgerald and Lincoln Brick Park, removing that hazard to the public. They are working on hauling away all the demolished boardwalk from Keeney, and that'll be an ongoing process throughout the winter months as we continue to remove more of that lumber. And then the dock at Crandall will be removed in the fall as well. They're also working on removing debris from the Fox pit toilet demo, as well as working on widening out the Paul Henry Trail. So we have a section of the trail that is not paved, and each season we have to go out there and clear the sides of the trail to make sure it, is usable for the public. This fall, we also have some volunteers that are going to be coming into Crandall Park as well as Lincoln Brick Park to remove autumn olive and some honeysuckle. And then we're also going to be removing the swim buoys at Fox Park in the near future. Any questions?
Yes, Commissioner.
Okay, so out to Fox Park, I noticed you have vines growing amongst all those trees next to the farm field. If we leave all those vines growing, eventually it'll destroy the trees.
So a lot of the vines that you're referring to, those are native species, like your 5-leaf ivy, your riverbank grape. So they might shade out the trees, but a lot of that stuff is sumac anyway, so it's going to pop up again somewhere else.
Okay, so you don't try to keep it under control? Because it's like getting pretty bad.
So what
I'm worried about it opening up all that whole tree line.
Are you referring to the property line on the western side of the park? So if it impeded the way that public were interacting with the park, we would manage it. But right now, it's not really impacting any trails or any paths. And the species are native to Michigan, so.
Okay.
Oh, yep.
On your trail pie chart,
Yeah.
how do you know what the daily average is? What do you base that on?
So these monitors, you set them up on a trail, and then they shoot out an infrared beam across the trail, and then as people walk by.
How do you know it's not a deer walking by?
So it's possible that a deer might be counted, but it's not, these are all averages. It's not going to be big enough to really impact the data.
So it Fitzgerald, because of the construction, isn't that gonna kind of fuel your data? Because some of our trails aren't able to be used.
So right now, all of the trails at Fitzgerald Park are able to be used. The city of Grand Ledge has put up signage and opened up the paths where they were recently closed. And, yep. And then we also have maps telling the public where all of our construction is ongoing. And the one monitor that we do out at Fitzgerald Park is not anywhere near the construction, so.
Yes, Commissioner.
Thank you, Mr. Chair. Thank you, Ethan, for your report. Question, where is Butler Park?
Butler Park is down in Bellevue.
Okay. And that was the project where we were talking about, there was a grant for, okay, all right, thank you for refreshing my memory on that. And then, at Fox Park, the bike trail that goes off to the east, to the north of the lake, what's the, are we looking at that for restructuring that, rebuilding that? What's the plan for that at this point?
So the bike trail is managed by the Mid-Michigan Mountain Biking Association. They do all the mowing, all the maintenance out there for that. As we continue to develop Fox Park, I'm sure we will be restructuring it a bit. I know that in the strategic plan, there are plans to put a couple pump tracks out there so people can warm up prior to going out on the trail. In the near future, we probably won't be changing those trails dramatically at this time.
Okay, because it's, I mean, to walk it, it's not very friendly with the way that it's just structured. It looks like old pallets laid down in the swamp, really, is what it looks like. But, and part of it I know was cut off because of the storm that we had go through there a few years ago. But I'm assuming at some point we're going to take a serious look at that and restructure that entire thing and make it more handicap accessible and that sort of thing.
Yep, that's the goal.
All right. Do we have any timeline on that possibility?
I would imagine probably the next coming budget year. So not
Okay.
the current budget year, but the following one.
And we'll do that in collaboration with that bicycle group.
Yeah.
All right, thank you.
I would like to say, thank you for setting up the trail cameras. I think this is a good way, and you stated in your report that we can properly allocate funding to the parks that get the most use and/or improve the parks that aren't getting the use to increase their usage. Though I do like improving trails, I do say a mountain bike trail is for mountain bikes. And if you do too much good work to it, then it becomes a pedestrian trail, and then the mountain bikes no longer have a trail. Just saying. So, any other questions? Any other comments?
I do.
Yes.
So I wanted to discuss a little bit, the committee here and the board had dealt with vacancies within the Parks Department over the last, well, it's been a year worth of vacancies. So we had a 4-month vacancy, and then the vacancy occurred in September of last year. And Chad and Claudine have stepped up and been attending meetings with the Parks Department and working very closely with Ethan. So I wanted to let you know that we met and we discussed putting Ethan as the interim director, which we did make that decision. He is acting in that capacity. He was an integral part of the design plan for the strategic work that we're going to be doing in all of the parks. He's extremely committed. He signed something saying he's never leaving, so that's good. But we did classify it right now just as interim while we continue to just evaluate what he's doing, and Claudine and Chad will stay on top of anything. And obviously, the structure right now is that Chad deals with the maintenance And Ethan's going to deal with all of the operations and any programming throughout the parks and improvement to the parks along with Chad. So we're really pleased to announce that this is Ethan's new role and that he agreed to accept it. And just wanted to let you all know that we look forward to a great working relationship.
Well, I'd like to congratulate
We're
each.
going to Commissioner Mott first.
Oh, I'm sorry, okay. I withdraw my comment.
No, I just wanted to say thank you for taking on that role. But I'll also say I had a Eagan County Historical Commission meeting last night. And when I announced it, Julie Kimmer said, just go ahead and make him director already. He does everything he ever says he's going to do. So she was very pleased with your work as well. But I do want to make a comment about we have a Parks Work Group meeting. And I was the only one that showed. So these are important. The staff put a lot of time into these. So if you can't make it, let the staff know and we'll reschedule. So this isn't a scolding. It's just something that needs to be done so that we have a more productive meeting.
Yes.
Thank you, Mr. Chair. I would like to congratulate Ethan on this elevation to this position, and partnering along with what Commissioner Mott said is, at what point do we change from temporary to permanent? But anyway, yes, I do recognize that I missed the meeting yesterday morning, and my daughter is glad that I missed it, so I'll just leave it at that. But I am very open to another meeting in the near future, so anyway, thank you, Ethan, for stepping up and taking that position.
Thank you. Looking forward to the opportunity.
All right. Thank you very much.
I'm really sorry. I would just add real quick that there is a new project list in your packet that has not been updated for quite some time. So there is a new project list in your packet. You can look through that and see what's been completed and what is still out there. And also, Ethan and I are working on an RFP to update the 5-year parks plan, because that's a requirement to apply for any grants through Eagle, through the DNR Trust Fund. So we're working on an RFP to send that out so we can get that updated so we're eligible for grants.
Very good. Okay, thank you very much, Ethan.
Thank you.
All right, so we're moving on to committee appointments.
Yes, so there are two different items under this one. The first one is there is a vacancy due to a resignation on the Tri-County Aging Consortium Advisory Board. I included the definition of that board because it does have some requirements as far as age and whatnot. So that is in there. That is something that Blake Mulder was appointed to, and apparently he is going to be moving out of the area. So he is not going to meet the requirements to be on the board any longer. So that's vacant now. It would be filling the remainder of that term, which is December 31st of 2007. So we need to find somebody to fill that seat.
So is this an action? Is this one an action?
No, we need somebody to apply. It's just to let you know that there is a vacancy and that we need to work on getting somebody to apply to sit on this advisory board.
That you will be posting it in
Yes.
the paper and
Yep.
other social media?
Yes.
Okay.
Yep. The next one is the expiring appointments for committees that you appoint to through this board and the Board of Commissioners. So this is not a full list of all of them. This is just a list of the expiring appointments. So out of all the committees you appoint, this is the expiring list. So all of these people's appointments are expiring in December. So we normally bring this to your attention and then ask if you want us to reach out to these people to see if they're interested in being reappointed, if you want us to advertise it to see if there are any other eligible applicants. Do you want us to call all of them and see if they want reappointed? And if somebody says no, just advertise that vacant committee appointment. Just some direction on how you would like us to handle that.
Yes, Commissioner.
I just want to mention that I did speak to the board of the Historical Commission last night, and the ones that are expiring wish to continue, and they do not wish to advertise any additional positions.
I think, oh, yes, Commissioner?
I was just gonna ask, has there ever been a term limit for any of these positions? I mean, some of these, as I go through these names, they've been there for a while. And, I mean, that's not a bad thing, but,
Not unless their own bylaws dictate some type of a
okay.
requirement for that.
All right, thank you.
So I think it would be prudent that you reach out to these organizations, you know, the members on the board. But what kind of turnaround do you need? Because,
Appointments have to be made by the end of the year.
yeah, so we would have to approve the appointments in the December meeting, right? So
No later than, we
Yeah.
like to do it in
in the
November.
November meeting? Okay, does that give you enough time to contact these and then?
Yes.
Then, and/or put it out in the paper to advertise? Okay. Do you need a motion for that, or do we need?
I don't think so. We just want direction on how to move forward with it.
I would ask the other members of the board, I mean, do you have any, problem with that, or do you have any other suggestions, or? Okay, seeing none, I think that's what you do,
Thank you.
yes. All right, so opioid settlement update.
Okay, so back in 2023, the board, we started receiving settlement agreements pretty rapidly. So in 2023, the board authorized the controller to enter into participation agreements or settlement agreements as recommended by our national council. So we've been doing that. We have just become aware of a bankruptcy settlement with Purdue Pharmacy and a subsequent settlement under that with Sackler. And then there is another settlement agreement that is pending. So I have taken the action to enter into these or vote to participate, but I wanted to talk to the board about this and actually prepare another resolution, given the fact that this is a new board, and I'd like the authorization from this board to move forward. So we'll discuss it more at Ways and Means. It's basically just sitting back and waiting for these settlements. The other piece to some of the settlements now, where we're under a certain requirement on how to spend the funds in the Janssen and distributor lawsuits, those are pretty specific. These settlements, a couple of them have different specific requirements. Some are allocating actual medications, and some are allowing you to take the funds that would come from medication to then convert it into funding for your own use, but it's very specific. So I want to make sure that we are following the guidelines, that the board knows that before we get into distributing opioid funds under the next grant cycle.
Okay. Yes, Commissioner.
I think I'm on the opioid work group, if there is such a thing. When do they meet? Or I've never done anything.
So they don't have a schedule to meet. Connie and I have been talking. They probably will meet here shortly because we'll be talking about the next round of the grant cycle for the funding.
I didn't miss that yet.
Okay. No other comments, questions? Okay. All right, moving on to miscellaneous.
No miscellaneous.
We don't have any public left. Matter of fact, we didn't have any anyway, so I guess there's no more public comment. And then that moves us on to the adjournment. I would like to adjourn the meeting and see everybody next week for another meeting that we're on.
Where's the application to become